Hello everyone, this is your host, Devika Kilker. I'm a physical therapist and I work for Advanced Therapy Innovations in Evansville, Indiana. So today I'm going to host a webinar on discogenic back pain. So just to give you a little background about what's all that's going to be covered in this webinar, we're going to go over some of the main causes of lower back pain, what is a disc, and what causes a disc to bulge leading to a discogenic pain, and what it is that you guys can do at home to help yourself. Okay, so let's dive in. So before we dive deep into the topic, just a little information about me. I have been a physical therapist since 2008 and I have completed my master's and doctorate degree. I have certifications in McKinsey. I have some in kinesiotaping, cupping, and myofascial release, along with a few other things. But that's the main gist. So, well, without further ado, let's begin. So, tell me, have you ever had issues bending, leaning, slouching, or sitting for a long time and experienced a sudden jolt of pain with any of those seemingly simple everyday activities? Have you had that sharp stabbing pain when you were lifting a simple pencil? Did you feel pain when you were coughing or sneezing? Have you had pain that is radiating down in your leg? If this sounds familiar, then your pain might actually be originating from an injured disc, which is commonly known as a slip disc, sciatica, or pinched nerve. In medical lingo, it's also called or referred as to discogenic pain. Alrighty, so let's take a deeper dive into what the disc actually is and what's its function. So if you look at the picture here, your disc basically contains uh, your inner jelly-like material that's called the nucleus pulposus and the outer rings that are called the annulus fibrosus. And this whole structure is actually sandwiched between the two vertebral bodies, and the main function is actually to impart mobility to the spine as well as provide some shock absorption. Now this disc is capable of mechanical deformation when forces are applied. Now what that means simply is when you are bending or doing any kind of movements, a pressure is generated which makes the nucleus or the jelly move in the path of least resistance. So say for example, when you're bending forward, you have a lot of pressure that comes in the front from bending. Now what happens is this jelly is forced to migrate backwards because of the increased pressure, and it keeps pushing on the rings in the back. Similarly, when you bend backwards, a lot of pressure or force is created at the back, making the jelly migrate in the anterior or the front direction, causing it to increase pressure in the front rings. Now, if you look at our everyday activities, there are very, very few activities that require us to bend backward, but most of our activities of daily living are involved where we basically need to bend forward. So think about the repetitive strain that is subjected on these posterior rings by this jelly, which eventually gives out on it and it leads to the bulging. So the other reasons are sudden strain or heavy loading, and that actually causes the rings to give out because basically they weren't ready to absorb that much shock. Also, just regular age-related degenerative changes can change the composition of the annular rings as well as the jelly, making it more susceptible for bulging. So when you do have a disc bulge, what happens is it basically bulges on the side or back, causing compression of these tiny nerves that come out of the back and supply your leg. So depending on the compression, you can have pain, or if the compression gets severe, then you can have numbness or tingling with it. So as you can see, if you can reproduce this pain by repetitive bending or certain other activities, then there must be a way to reduce that and decrease this the severity of the symptoms as well as heal the disc. So let's see what we can do for that. So just to give you a brief introduction about how I came to specialize in this area, it was back in 2013 when I was getting ready in the morning, putting my hair up in the ponytail. I had this excruciating pain that shot from my neck and radiated in both my arms, and I had numbness and tingling at the same time. And I can vouch that it was like the worst pain I ever experienced. So I basically started a steroid treatment right away, but it hardly touched my pain. Fortunately for me, one of my colleagues was well versed in McKinsey technique, and she basically offered me to help. So I was like, okay, well, I can give this a try. It's non-invasive, like why not? And to my astonishment, within 2 sessions, the pain was completely out of my arms and it was all centered in the neck. And as I continued getting the sessions and treatment from her, it was completely abolished. And to my amazement, I was like, wow. It basically changed my whole perspective on how I was treating the patients who had similar issues. And that piqued my interest in, in learning more about this McKinsey method of treating disc-related issues. So ideally, I would haven't like ignored that pain if it was minimal, or I could have went the pain medication route, which admittedly I did, and it didn't help because I did not address the root cause, that was the discs. I mean, I should have thought about it before, but sometimes it happens. So what can you do? Well, there are a few things that are really basic in, first of all, preventing this disc bulge, and if you happen to get it, then to correct it and make sure that you are on the path to healing. So the very first thing is postural corrections. Postures that include slouching, bending, leaning can increase the pressure on the disc and lead it to herniate or bulge. Other things you can do is modify your everyday activities where, for example, in this picture, you can see she's sitting really upright, has really good support in her back, or as we refer to the lumbar region. Similarly, at home, when you're sitting watching your TV, you can use a small round pillow to support your lower back and help sit upright. Other things can be learning correct lifting techniques, like using your hips and knees versus bending from the back, and getting physical therapy treatment if everything else fails, and get treatment from folks that are actually trained in McKinsey that can target the disc and decrease the bulge. That's your root cause, and give you some pain relief. So here's what we can do at home. The first, as we talked about, is your postural correction. Really focus on your posture. Try to engage a family member who can correct you every time you slouch and kind of give you that gentle reminder, hey, to sit up straight, right? And then as we talked about, using a back support, using correct lifting techniques, even sleeping. You want to make sure that you're really sleeping on a nice firm mattress that supports your body and it's not cradling your back. That creates that bending posture and increases the strain, thus leading to further herniations or even worsening your symptoms. You can do exercises that are specifically McKinsey exercises that help with the disc bulge, like your press ups, like the lady that's doing up here on the mat. You basically start laying on your stomach with your hands underneath the shoulder. Now, keeping your hips on the floor or on the table that you're doing this, try to peel your chest off using your arms. You may feel a pinching sensation in your back, which is absolutely normal and to be expected. And the more you do these exercises, it will help eventually decrease the bulge. Because what we are trying to do is we are trying to create an excessive force in the back to cause the mechanical deformation that the disc is capable of and does moving the disc bulge. The consistency and the repetitions is the key. Make sure you're doing these exercises every couple hours and at least 10 repetitions. You can also add heat or ice depending on how acute the condition is. So a successful PT treatment will have other components to it, like hands-on. joint mobilizations, muscle energy techniques, some soft tissue release techniques. It will also include core strengthening so you don't get in this position to begin with. They will also suggest some ergonomic and lifestyle modifications and media modalities like heat, ice, TENS, depending on your pain levels. So hopefully the seminar gave you good enough understanding about how a disc works, what you can do to prevent a disc issue, and if you do happen to get it, what you can do to treat yourself. If you still have any issues and you're not getting your results as expected, please contact your local physical therapist who can further assist and guide you in the process. So guys, thank you so much for attending this webinar, and if you have any questions or concerns, I have attached a link to my website at the bottom of the slide. Please feel free to get in touch with me via that, or you can go on our Facebook page and leave us comments there. I will try to respond as soon as I can. And also, if you have any other suggestions regarding other webinars you would want to listen, please put that in there as well, and we'll try to get on to that as quickly as we can. Well, thank you so much, and have a happy, safe, and healthy week. Bye-bye.